Hello, my name is Slavka Baronikova and I am the Scientific Publication Team Leader at Galapagos, a biotech company in Belgium. Today I'm presenting our poster assessing PubMed meta tag usage for plain language summary discoverability on behalf of my co-authors at the multi-sponsor collaboration Open Pharma. Our conflicts of interest and funding disclosures are listed on the screen. Plain language summaries, or PLS, are important elements of scientific publications for improving accessibility and breadth of readership, but they need to be discoverable to be valuable. PubMed is one of the most popular search platforms for biomedical research. Since 2019, PLS can be shown on a publication's PubMed index page, but the content must be tagged correctly. You can see an example of a PLS on PubMed in the middle of the screen. Open access publishing is also important for discoverability of both PLS and the main publication. In this two-part analysis, we aim to determine the proportion of all PubMed records correctly using the PLS tag and to characterize the reasons for incorrect usage. We also aim to establish the open access status of the publications with PLS and PubMed and their respective journals. To do this, we used informatics methods to download the entire PubMed database in February this year. We then searched the XML code for records with the PLS tag in the other abstract field. We removed duplications and instances of incorrect tagging, and we categorized the reasons for incorrect tags. For the open access part of the analysis, we took the list of correctly tagged PLS and checked their open access status on Unpayable Simple Query tool. We also categorized them by journal and checked each journal's open access status on Xylogen. Out of over 30 million articles on PubMed, we found 3,217 with a PLS tag. Out of these, about 15% were considered incorrect tags. Reasons for incorrect tags included having a non-English scientific abstract instead of a PLS, having no scientific abstract in the abstract field, having a duplicated or extremely similar PLS to the scientific abstract, having no content at all, or using the PLS tag for many other things such as URLs and article highlights. On the other hand, 85% of articles had correctly tagged PLS. Out of these, 78% were published open access. Out of other key findings showed that the proportion of PLS on PubMed represents a prevalence of 929 per million articles for 2021. And at the journal level, all journals that had published PLS on PubMed were Gold Open Access or at least had Open Access option available. Interestingly, there were also some publications using the PLS tag to index both a non-English language abstract and an English language PLS. Overall, we know that PLS numbers are increasing over time, but our findings show that PLS on PubMed are still a very small minority, and we suggest that having explicit guidance could help improve uptake and correct tagging. Our study had several limitations in that there was a relatively small sample size which was beyond our control. We also did not do any quality assessments of the PLS to confirm they are truly written in plain language, but we acknowledge this would make for a very interesting and informative analysis in the future. Our take-home message is that PLS represents an important opportunity for publishers to improve the impact of journal content and reach a broader audience. And correct tagging of PLS in PubMed will further help this.